Namaste. Are you someone who's looking to improve the shape or density of your beard or mustache and you're thinking about hair transplant for the same, but whenever you search for hair transplant, all you seem to find is regarding scalp hair transplant? I'm Dr. Aniket Venkatram, plastic surgeon at the Venkat Center for Skin ENT and Plastic Surgery, Bangalore. And today we are going to discuss about facial hair transplant, a type of hair transplant that is a little less common, but you'll be surprised as to how many people actually want it. So, what is facial hair transplant? In simple terms, it is doing hair transplant onto the face. You're removing hair from the back of the head and putting it onto your face. Normally, hair transplant is done for bald areas in the front of the head, but it can also be done in the face. So, who are the patients that come looking for facial hair transplant? Well, you could say that there are mainly three types of patients. The first is those who are unhappy with their natural beard and mustache shape. There's nothing abnormal, but they just wanted to look better. Maybe it isn't that dense. Maybe they only get hair in the sides, they don't get in the center. Maybe their mustache doesn't join their beard. Maybe they don't get hair in the goatee area. So these are all examples of people who want facial hair transplant for cosmetic reasons. The second group of patients are those who have some underlying hormonal conditions. And because of these hormonal conditions, they are not able to grow a beard and a mustache the way the rest of us can. In the body, you need these hormones, usually testosterone, to grow normal facial hair. But with these kind of patients, they are unable to grow this kind of hair because of these hormonal conditions. And finally, you have those patients who used to have a normal good facial hair, but either because of diseases or because of scars, they have areas of hair loss which they want to get treated. So, how is facial hair transplant done? Well, before the surgery, obviously we need to evaluate the patient. First, we need to rule out whether there are any hormonal conditions or not. This might require some blood tests. Once it is determined that the patient does not have any hormonal conditions, then the facial hair transplant can be planned. So, with the patient, the outline is drawn and it is discussed with the patient. The patient tells us what kind of look they are looking for, and then we plan appropriately and decide the number of grafts that are needed. Then the rest of the procedure is similar to a scalp hair transplant in that we extract hairs from the back of the head, what is known as the donor area. This can be done by FUT or FUE. FUT is the strip surgery, FUE is the dot surgery. You can read more about these in our other videos, the links for which you will find on your screen right now. So once these donor hairs are harvested, we make holes in the face and we implant those grafts in the manner that we want. After surgery, those grafts fall off in around 2 weeks. New hair starts coming out from the third month, and you see the full result in around 6 to 7 months. Now, you might ask, is facial hair transplant different from the scalp hair transplant? The answer is yes. It is much more difficult. It is much more challenging. Let us see why. Firstly, the face is a mobile area. You're talking, you're eating, you're chewing, you're smiling. So all these areas move, whereas the scalp is an immobile area. So it is far easier to implant hairs into the scalp than it is into the beard. This makes it much tougher. You need someone who's very good at this. Secondly, here everything is visible. You need to draw the hairline, you need to draw all your markings very artistically. In the scalp, except for the frontal hairline, the rest of it is not really visible. So this requires a much greater artistic touch. Thirdly, the hairs here come out at a very acute angle. They don't come out straight, they always come out at an angle. And this is something that has to be done during the hair transplant surgery, and this is not easy. Fourthly, the grafts needed on the face are usually single and two hair grafts. You should not use 3 or 4 hair grafts on the face, otherwise it looks kind of pluggy, it doesn't look nice. So you have to isolate and use only these kind of grafts, and this is not something that a beginner might know. For all these reasons, hair transplant on the face is much more challenging than on the scalp. Whenever you're doing a beard or mustache hair transplant, it's important to understand that after the first surgery, there is a small chance that a few months later, you might want to do a small touch-up and put in a few more grafts to increase the density. This is important because in the first surgery, you can't plug in too many grafts. They won't survive, they will die. You will spend money unnecessarily. You have to do what is safe and do it step by step. Now, what is the recovery after surgery like? The recovery for facial hair transplant is a little bit different from the scalp. In the scalp, you can pretty much be normal from the next day itself. Whereas in the face, the swelling is a little bit more. So if someone were to see you, they might ask you, hey, have you had something done? Secondly, for a few days, you need to avoid using your lower face a lot. You need to avoid eating very hard foods. You need to avoid talking a lot. This is to help immobilize the grafts and ensure that they take well. Now, the question is, what can go wrong in a facial hair transplant? If it's not done correctly, there are many things which can go wrong. Obviously, you might not get the result. You might end up having paid all that money for nothing. Secondly, you might get a result, but you might not be happy with it. It might be patchy. Some hairs might have grown, some hairs might have not. The hairs might be coming out in weird angles. 3 or 4 hair grafts might be used. It might look pluggy. And if the grafts are not inserted properly, they can cause cobblestoning, which is where you have this kind of bumpy appearance on your skin, especially when you shave your beard. These are all things that can go wrong if you don't do your hair transplant with an experienced person. So this brings us to the Venkat Center. At the Venkat Center, we have done thousands of hair transplants, including many facial hair transplants. Dr. Venkat is an authority on the subject and has written a textbook on the same. So make sure you find a good experienced doctor who is particularly experienced in facial hair transplants before deciding to undergo the same. I hope you enjoyed this video and you found it informative. If you have any doubts, do feel free to get in touch with us. Our information is in the description and it will be appearing on the screen shortly. If there are any other videos that you have in mind that you want us to make a video of, you have certain questions, leave them in the comments and we will do our best to produce those videos on you. Your support means a lot to us, so do subscribe to our channel and recommend us to others as well for all things related to skin, hair, ENT and plastic surgery. Thank you very much. Have a good day.